Welcome to the Mindful Healers podcast with Dr. Jessie Mahoney.
And Dr. Ni-Cheng Liang.
We are physicians and leaders who are also trained in coaching, yoga, mindfulness, and integrative medicine.
We are also mothers, spouses, sisters, daughters, aunts, and friends.
In this podcast, we share candid, heart-centered, loving, science-based, thoughtful, and often fun conversations about the challenges life throws at us.
With our collective experience of over 30 years in physician and personal wellness, we reflect and offer pearls of wisdom for navigating life's challenges with more ease.
From parenting, marriages, money scarcity, cancer survivorship, uncertainty, challenges in practicing medicine, we cover it all.
We invite you to refresh your perspective and empower yourself with mindset, mindfulness, and other well-being tools that actually work. A quick reminder that nothing in our podcast is medical advice.
So today's topic is unreasonable expectations. And I would say it's your own unreasonable expectations of yourself and the unreasonable expectations of others. And this has come up because many people I work with have issues with unreasonable expectations of themselves and not being sure whether the requests of others, especially if you're in leadership, are unreasonable, or maybe the requests of your mother-in-law are unreasonable, or the requests of your teenagers might be unreasonable, or your husband might be unreasonable. So the idea is, how do we know when it's unreasonable, when it's reasonable, and what can we do about it? And so I like to always start with some questions, and this idea that, do people you work with have unreasonable expectations of you? Do you have unreasonable expectations of others? And I smile there because almost all of us do, because we are high expectation people. So just a hand heart that of course we do, and of course they do. And are your expectations of yourself reasonable or unreasonable? And how do you tell when something that's being asked of you is reasonable or unreasonable? And most women and women doctors in particular struggle with that one because we are people pleasers and perfectionists, and we want to make everyone happy. And how do we tell if our own expectations of ourselves are reasonable? So we're going to dive into all of that. I want to start, though, with just a moment of mindfulness. And I often start with a moment of mindfulness in a strategic way, because when you are relaxed, we'll have more fun. You'll hear what I have to say. You'll be more open. And it is also one of the strategies that's going to help you figure out what is unreasonable or reasonable. And just take a moment to land back in your body and notice how you feel. Coming back to your breath and breathing in through your nose and out through your mouth. Letting yourself settle and arrive and slow down. Slowing down to notice. Notice where that tightness is. Is it a lump in your throat? Is it chest pressure, belly lump? Is there tightness? Just noticing where you hold it. Noticing where you get your information. Noticing if you're connected to any information within. Breathe in through your nose, sending it to wherever there might be tightness. And exhaling, let it out. And bring a hand to heart. And the other hand might be hand to belly or hand to heart, noticing where maybe you feel that tension. And if it's in your throat, maybe it's a hand to throat, but not a tight hand. Just checking in and listening. What is the message in that tension? Breathing into it again and breathing out. Noticing your nervous system here, inviting it to soften and melt a bit, and giving yourself permission to listen. No obligation to do anything in response to what you hear, but just letting it be seen, witnessed. Our body actually carries tons of messages. Allowing that to be true and remembering that even though we were taught that our body's messages are irrelevant in medicine when we're working, perhaps there's lots of information in there for you. Can you notice it without judgment of yourself or others? Taking 3 more breaths just simply because it feels good. At the end of the day, bathing every cell with a little oxygen, a little nourishment, a little kindness and compassion. Repleting yourself a little bit. Knowing that when we are more calm and slow and practicing kindness to ourselves and our little replete, that's when we can learn and grow and change and consider different perspectives. That's where we can listen. Breathing in once more, in through your nose and out through your mouth. And when you're ready, you can lower hands and open eyes and just noticing how you feel. I think that mindfulness is really, it's not, I think, I know that mindfulness is the key to recognizing whether things are reasonable or unreasonable and becoming aware. And so some of those tools that I just mentioned in the mindfulness practice are helpful. And so slowing down enough to notice, noticing where you have overwhelm, where you have frustration or tightness, noticing your tendencies perhaps to just do more and more or suppress how you feel or to put your head down, noticing tendencies that we all have in medicine to self-sacrifice or take responsibility for things that aren't ours, or to be a martyr, or to practice toxic independence. Um, and maybe even to be a savior, as someone mentioned, being available to all your patients before you take a month sabbatical. That might not be reasonable, for example. And so I think it's really important to take some time to think about what your expectations of yourself are and are they reasonable? And when I do this process with people who coach with me, we often talk about something called a manual, which is your list of expectations for what you would do as a mom, wife, sister, child, um, any of those things. And so I think it's a very worthwhile practice to actually write all of those down and notice what they are. Because when you do that, you can see that many of the things you might write down might not be in your control. They might not be your job. They might not be reasonable. In fact, most of the time they are not. And so when I usually have people do this in the beginning of coaching, it might be my job as a mom is to raise happy, healthy children. That's not in your control. You can take them to the doctor. You can offer them healthy food. You can't even feed them, make them eat it, honestly. You can give them your wisdom. You can make the best decisions you can, but whether they turn out happy and healthy is actually not in your control. And thinking about those same things at work, we're often held accountable for things that are not in our control. So we're very used to giving ourselves jobs that are not in our control. And so I would encourage you to write down, well, what is my job? What do I think my job is? We'll get to what other people think our job is, but what do you think your job is? And is everything on that list a reasonable expectation that a human being could do in 24 hours? Because most women in medicine, their list is usually a 48-hour list in every 24 hours. And then they wonder why they are feeling so stressed and anxious and have achy body parts and lumps in their throat and feel like they can't breathe. And so this acknowledgement that perhaps your expectations of yourself are not reasonable And many people think, well, if I don't do them, then who will? And then we go into our default patterns of catastrophizing and over responsibility and going to the negative, and our children will end up in terrible places with terrible things happening to them, which is very unlikely. Or our partners will leave us, or who knows what. But recognizing that that's just our tendency can be really, really helpful. And then deciding how you want to show up. And so I encourage you to instead, once you've seen all of these perhaps unrealistic expectations, some of them will be really useful and you'll want to keep them. Decide which ones you want to keep. Decide more generally, how do you want to show up? So let's say that you want your patients to be happy with you. Okay, that's out of your control, but you can choose to show up loving, caring, paying attention. I always say, what would love do? You can show up asking that question. You can show up asking what caring would do. You can show up with peace for maybe a relationship with a mother-in-law or something like that. You can show up connecting, like you might want your partner to be connected to you. All you can do is show up connecting. And so setting intentions very specifically around what you want is really, really powerful. And then the other piece is really connecting within. And so we practice that a little bit in the mindfulness, but understanding that we can connect with our inner knowing or our intuition or trust your gut. And I love this word, that not a word, phrase. It's the art of your stomach. Your stomach knows when you're asking yourself to do something out of that's not reasonable. Or it might be, some people's stomach is very noisy. And so they could actually trust their gut. Or some people, I'm more a heart-based person. And so for me, I can trust my heart. And for that, that's where actually this tactile touch of hand to heart or hand to belly can give you information. Remembering that in medicine, we were taught to ignore all this information coming from ourselves. And so you actually have to practice it. And that's why we call it practicing mindfulness, practicing self-compassion. So practice listening. And to listen, we have to slow down. We can't, and we have to pause. In that mindfulness practice was 2 or 3 minutes, so it's not long. And when you learn to listen again, then you have this information, and you usually, your gut knows when your things that you're throwing on yourself are unreasonable. That's where you don't sleep well. That's where you feel anxious and tight and exhausted and frustrated and maybe irritable and maybe short. And so recognizing that. And so know that you are a stomach person, you're a heart person. Where is your information and where do you want to see? There's a book by Rachel Naomi Remen, and she talks in the author's note about seeing with your heart. So what if you saw with your heart, what would your expectations of yourself actually be? They would be very different than what you first wrote down. And I think that we tend to not trust ourselves and discount what we know. And we actually do know what's reasonable and unreasonable, but we judge ourselves for it because we were trained to judge. And we don't show ourselves compassion, and we're mean to ourselves about it. And so we just stick to that and wonder, why am I so overwhelmed? Why am I so exhausted? So those tools can help you. The other piece is focusing. So you're going to focus on your listening, you're going to focus on your intention, and you're going to focus on what's in your control. And if something is not in your control, it's not your job and it's an unreasonable expectation. So I often will say, okay, what's in my control about this? Is something that you're asking yourself to be responsible for not in your control? Then that's unreasonable. And this idea of these unreasonable expectations keeps you out of that tendency called over responsibility, which there was a podcast about that a while ago, and it keeps you out of that space because you will know. It keeps you out of fixing and changing others. And so a few ideas about focusing on what's in your control is asking, okay, well, what can I do? What can I say? How do I want to feel about this? What tone and energy do I want to bring to it? And none of that is determining the outcome. It's just determining how you experience it. And that will give you back some empowerment to allow you to shift. So what I think our job is around our own expectations of ourselves is to trust ourselves which many of us are terrible at. So that takes a lot of practice as well. We were in many ways taught not to trust ourselves. We should look outside ourselves for external validation. We should look outside ourselves for the right or the wrong way and what we're supposed to be doing. And honestly, if you do that in our society today, every woman would fail every day because all of the expectations are unreasonable. And so the other thing is asking good questions, asking what's in your control, asking what's reasonable, asking, is this my job? Is this mine to fix? And letting go of what is not. Um, so I think that that is a very helpful way to think about it. And then is really thinking, um, is what other people asking you reasonable? And I would offer that I think that most of us in medicine now have a very clear idea of what is reasonable for patients to ask for or not. We're usually very clear if it's unreasonable, and it's usually not dramatic in our mind. We're like, that's unreasonable. I can't give you narcotics, or I can't do this, or I, of course, can't respond in this way. And we tend to have not as much drama about it. But the reason I bring that up is because you actually know what's reasonable and you know the cues when you think to that. How do you know it's unreasonable? Where does your body tell you it's unreasonable? What does your brain just say automatically? It's like, oh, that I couldn't possibly do that. That's not in my control. I can't, maybe it's out of alignment. I can't write a service dog prescription for something. We usually know and are very clear, and we know in our gut. And so this is a message that you can trust yourself. So that's the first way to sort of figure out what's reasonable if it's someone else's expectation. Then the other thing is to say, is it in my control? Is it my responsibility? Is it my job? And I would compare this, how do you respond to the patient situation versus when admin or leadership asks you to like cover all the calls because someone's out. We tend to go right into guilt, blame, and shame, which is going to let you know that it may not be reasonable, which doesn't mean you don't help out, but deciding where is it in alignment? Where can you help out and still be authentic and aligned and not be sacrificing yourself and not taking responsibility for things that are not yours? And if you happen to be a leader, and that's actually where this topic came up from someone who was a chief of a department and her whole department was falling like flies to COVID. And it was an OB department. And so they actually needed people in the hospital to deliver babies. And so they were having to pull people from clinic and all of this. And there were literally not enough bodies to cover the places. And she was expected to solve this problem. But that's impossible if there are not enough bodies and you're required to be out if you have COVID. And so people were saying, well, you can just, in extreme circumstances, you can make people with COVID come to work. That would be an unreasonable expectation. And it's unreasonable of her to think that she could solve this. Like, it's actually resisting reality to think that you could solve it. And so allowing yourself to see, like, is that realistic? Am I resisting the reality of the actual human bodies available to cover this? And knowing very clearly that we are very often in medicine asked to do things that are unreasonable. Probably our training was unreasonable if we look at it now especially for those of us who trained a while back. It was unreasonable to physically ask people to stay up for 48 hours and not pee for 12 hours and it's actually unreasonable. But we are very used to doing unreasonable things, so we don't question it. We just assume it's okay and we just do it. And when we start to question it, we actually judge ourselves and feel bad. What's wrong with me? Why can't I get it done? And I coach a lot of women who are like, but I'm so overwhelmed. And it's like, well, is what you're asking yourself to do, two leadership roles, raising children, taking care of a sick mother, is that actually reasonable? Is it possible to do? And acknowledging just the hand to heart that maybe it's not is really helpful. And then you can decide from there. It's much easier to figure out, oh, maybe I can get help, or maybe I need to not have all of these leadership roles, or maybe I do B+ work instead of A+ work. Maybe I focus on safety, but not people pleasing or making all of my patients happy and getting what they want, for example. And so when you're out of this, just the swirl of not even recognizing what's unreasonable, you can't solve it. And so it's the recognizing piece that's the most important. And so recognizing whether it's you having your own unrealistic expectations of yourself, or recognizing when our leaders have unrealistic expectations of us. The other words I just wanted to throw out here, because when you are a leader, but your higher leadership, it's so funny, we have all these layers of leadership, um, ask us to do something that's unrealistic. We very often feel like an imposter, like what I'm not supposed to be here because I don't have the solution. That's often our default. And so when you feel like an imposter, another clue that it might be unreasonable. We also throw out these words like servant leadership. So you should just give, sacrifice, martyr yourself as because that's what a leader would do. I would challenge that and say, I actually don't think a leader would sacrifice themselves. A leader would help, and would every one of you does the best that you can every day in your work. I don't know a physician who doesn't. I know there are probably few in the world, but they're few and far between. And so recognizing that you never intentionally come to anything not trying. And so to add that layer of guilt or servant leadership, or you're lucky or privileged or honored to be able to do this, it gets us into this spot where we just give and we don't listen to our inner knowing. And so recognizing that some of those things are triggers. We also are absolutely terrified of disappointing, because if you disappointed in training, bad things supposedly happened. And so we tend to really fear it and do almost anything to not disappoint patients, not disappoint leadership, not disappoint our partners. And then we are doing things that are unreasonable and unsustainable. And so I think when we're continuing to practice things that are unreasonable, that's where we end up burnt out. And now I want to fully say that what we are being asked to do in medicine right now is probably unreasonable. And so recognizing there, okay, well, if this is unreasonable, what is reasonable? What can I do? And I really like this idea of offering what you can do. So you go back to the case of a department where everyone is out. It's like, well, what I can do is I can have somebody cover labor and delivery, for example, but I can't staff a full clinic, or I can't being really clear what's possible, where are your resources. And I would also add, and going back to the podcast about not apologizing, don't apologize if it's not your job and you shouldn't be fixing it. You just say, I wish I had more people, but I don't, so I can't staff that. And so it's, you can inform, right? This is what's possible, this is what's in my control, and this is what I can do. Um, and I love the, I wish I had more doctors, I wish I had more time with patients, but don't say I'm sorry, because that implies it's your fault and it's reasonable expectation. And then we perpetuate these unreasonable expectations. And I think that can actually really change your energy around this. And when you stop saying you're sorry, you then stop having those expectations that that's what you should do. And you can, with a very clean and clear heart and mind, say to leadership, well, actually, that's not possible, right? It's actually not possible to see, I don't know, 30 patients in a day, for example. And so I think when you tap into these things and you're getting out of the frustration, anger, reactivity, that's the mindfulness, you can be more clear about what are my options. So the thoughts that I have about what to do when you know it's unreasonable, and that's where I go into it should be different, but how can we make a difference? And so if it is unreasonable, and I will use the example of you're about to take a 1 month sabbatical, and the expectation is apparently you'll fit in all the patients that need to be seen. That's unreasonable. So it's like, what can you do? How can you make a difference? And so pause and breathe to shift your physiology, literally nourish yourself so that you're responding very intentionally. Practicing self-compassion and the physical act of it. So hand to heart, hand to belly, grounding, oxytocin, like create that neurochemical soup whereby you will respond to these unreasonable expectations very reasonably. You will inform, you will say, I wish, you will let people know what you can do, and focus on that. And then trusting yourself. So sometimes we have to grow the trust. Most of us don't trust ourselves, but recognize that you can trust yourselves. Every single one of you here is reasonable, responsible, and wants to do the right thing and always tries to do the right thing. Where we get into trouble is when we try to do way more than we possibly could. And that's actually where things go wrong, when we try to accommodate unreasonable expectations. And I think it's really, really helpful to decide what is my job. And I think that that is important at home. It's important at work. What is your job? And not what they think your job is, but what do you think your job is? Your job is to see the patients, it's to provide the best care you can, right? But it's not necessarily, in the pediatric example, to convince everyone to get their vaccines, because that's not reasonable, for example, right? It's probably reasonable to convince 90% of people to get their vaccines. And so recognizing, well, what's my job? And I would say I wouldn't even pick a number. I would say my job is to um, know about persuasive education, tell them what I know, tell them what the risks and benefits are, tell them my recommendation, and show up loving about it. And that's what I can do. And so recognizing, well, what is actually my job? What is my job if there aren't enough bodies? It's certainly not to fill in every other night call shifts. I had a client in ongoing presence whose department, whose family practice, was half staffed. And so they just had them taking call every other night to deliver the babies because there weren't enough people. I'm like, that is actually not reasonable. It's actually dangerous. And when they informed them that actually they weren't going to be doing that, it actually worked. But they hadn't actually. They just like, well, it's our job. They just want us to, and that's what we should do, because what will happen to the patients? It's not your job to fix that. That's unreasonable. And so we actually, sometimes we think, well, the patients will suffer if we don't just do it. And I will say they will suffer if you just do it. So, or your patients won't get the care they need before you leave because if you're squeezing them all in, for example. And then asking really good questions, which is what I often talk about. And so deciding what you want to be your guiding light. So I'm going to go to what would love do? Like, what would love do in the face of these unreasonable expectations? Or you choose your word. What would peace do? What would responsible do? I actually like that, because responsible wouldn't comply with unreasonable things. It would call them out as unreasonable and not possible and move on. And so asking yourself that. I also like this idea, what would someone who respected and valued herself and her patients and her colleagues do if this is a work situation? Or what would a mom who wanted to be whole and healthy and present for her children do? Or what would a spouse do if whatever your other spouse felt unreasonable to you or didn't feel in alignment? Again, asking these questions can be really helpful. Or asking your future self is the other one that I love. Next month, what will you wish you had done? Or next week or tomorrow, what will you wish you had done about maybe an unreasonable expectation that you would just fit in all the late patients? Or oh, I love this one, see all the patients for the doctor who called out sick, because someone has to see them. So I think it's helpful once you start to see these things, you're like, oh, okay. And then this one is the really hard one, which is you have to be okay with the discomfort of calling out informing people that's not actually possible for you, and disappointing people. So we were trained in medicine that feeling uncomfortable is dangerous. Like when we have that cue, it's like something's going wrong with the patients. I know at least one of you is in the ICU, right? When you feel uncomfortable, you're like, oh my God, what do I do? So you'll feel uncomfortable in this situation, but it doesn't equate with danger. And disappointment is very triggering for people in medicine. We are all people pleasers. We want to make everybody happy. We want to fix, manage, control, and make everything amazing. So when we disappoint people, it's very triggering. And you just have to sit with it. Say, okay, I'm going to disappoint some people and I'm going to feel uncomfortable. And it still can be the right thing to do. It still can be what love would do. It still can be what peace would do. It still can be what someone who's reasonable would do. So I find that that is probably the hardest thing for people to do, is to be willing to sit with the discomfort. And that loops you right back to your mindfulness, because in mindfulness, we sit with discomfort. We're patient with it. Doesn't have to go away. And you don't have to solve it. I think a lot of times people think that when we coach, oh, I won't feel uncomfortable anymore. I'll just move through and there'll be no problems. What I'll say is you move through the discomfort much more quickly and with more ease and grace, but it doesn't mean that there isn't discomfort, and it doesn't mean that people aren't disappointed. But when you're okay with it plays a very different role, and you can still stand tall and not break under the weight of all of those unreasonable expectations.
Thanks so much for joining us.
We encourage you to dive into the show notes for each episode for more learnings and resources.
We also invite you to take a listen to the many other Mindful Healers podcast episodes. And please share the podcast far and wide with colleagues, friends, and family.
If our message and approach resonate with you, we would love to work with you.
When you listen to a podcast, you consume information, but when you work with us, you can actually practice and change.
We offer coaching and mindfulness experiences, talks, workshops, retreats, and more. Connect with us at themindfulhealerspodcast.com.
The content of this podcast is not medical or life advice. We invite you to participate in the mindful moments we offer at the end of most of our podcasts, but please only do so safely.